If you're a therapy nerd or a human performance junkie, chances are you've run into blood flow restriction and maybe already incorporating it into your system, into your daily training. If you've never heard of this before, a quick Google search will show you that BFR, or blood flow restriction training, is a very old and well-documented model for increasing load and the adaptation to load on the body without actually having to put the body under significant load. Originated in Japan many decades ago. We've seen its sort of distribution across from the bodybuilders and trying to build muscle mass and connective tissue synthesis all the way up now into rehab. And of all of the, frankly, physical therapy interventions out there, blood flow restriction is one of the easiest to research and turns out to be one of the best. In essence, what's going to happen is that you're going to use a cuff. In this case, we use this occlusion cuff by the Occlusion Cuff Company, and we just end up creating a wrap either high up in the groin or high up in the arm, and we add a little bit of pressure into the cuff with a SPIG. And the idea here is not to stop blood flow, but to make blood flow coming in more difficult and coming out more difficult. And what ends up happening then is that the body perceives some kind of physiologic change happening where we can have all the benefits of really high volume, high load lifting with stimulus adaptation and all of the wonderful changes in morphology, collagen synthesis, muscle activation, muscle growth that goes along with that without actually having to put the tissues under that kind of load and strain. So we're able to have much lower loading and sort of high physiology, low skill, which is in the term of rehab is fantastic. If you're unsure about this or want to incorporate it, I would definitely say talk to your physician, print out some research, show them what you're doing, talk to your physical therapist about it. And there are just some basic guidelines. If you have a DVT, deep vein thrombosis history, maybe talk to your doctor, talk to your physical therapist. Altered sensation in the limb, not sure what's going on. If you have heart disease, if you have some connective tissue issues, or you're on a blood clotting medicine, those might be reasons to say, hey, I want to take a look at this. But if you're already that person who's like, hey, I'm cleared, I'm going to the gym, or I'm getting on the assault bike, this is definitely a time to work this in. We see our most progressive physicians are beginning occlusion therapy, is another phrase for it, right in the hospital. A classic company, Katsu, kind of did some of the original heavy lifting on this. But in short, again, we can get lots of the physiologic change and adaptation to exercise without having to actually load the limb. So let me show you what's going on. I'm going to give you just a couple protocols for this. One is that we can actually move at much lower loads on the cuff itself and still have the same effect. So anywhere from 80 to 120 on the cuff of in terms of millimeters, anywhere from 100 to 180 is appropriate. And so we can really err towards much lower loads. And if you want to use, if your physical therapist uses a Doppler radar kind of system, then it's easy to find your desired sort of idealized pressure. Other companies make devices that are intelligent and sense loss of occlusion or loss of pressure or an occlusion pressure where no more blood flow is coming in and out, and it sort of will modulate down from there. But our basic model is you should be able to handle this load for 4 or 5 minutes. And what's happening is, again, we're trapping blood flow in there, but we're making it more difficult for blood flow to come in and exit, but also we're starting to accumulate a lot of the metabolites of exercise. And so this exercise can feel really, really aggressive. And it feels like a very tough physiologic exercise, like really intense exercise, which is great. And one of the reasons we love it is that we actually even use it in our training with our seniors and masters because it allows us to get huge pumps in the tissues, get the tissues engorged with blood, and keep an eye on some of these. If I have a range or a position or a joint that doesn't tolerate a lot of work, we want to spend those credits on actual sports. And then we can use the BFR training as a way of maintaining muscle mass and connective tissue health with much lower loads. Some of the bodybuilders are very strong and have gotten really great benefits from the strength training side. We're finding that it helps us to pick up latent musculature because the big motor units fatigue quickly, where the brain starts to call on other motor units, so we're able to get a lot of motor recruitment. Some of the benefits are that, if we move at the hip, and this is confusing, we're going to hit anything in the limb and above the cuff as well. So if I get the arm, I'm actually going to get the rotator cuff and neck as long as everything in the arm. So it's a systemic response to this. And also this helps us to keep the hard fought for muscle mass on our athletes. If you're one of my patients, you'll get this 1 to 2 times a day. And our model is pretty simple. So I'm going to just slip this up and give you an example of what it looks like. And our sort of tempo protocol, we've seen out there lots of traditional, sort of well-researched basics. And usually what ends up happening is they say, hey, perform 30 reps of something, rest 30 seconds. Perform 15 reps of something, rest 30 seconds, 15, 15, 15. So it's 30, and then 3 or 4 15s, depending on how good you feel, with 30 seconds of rest in between. And you'll also see prescriptions around, hey, let's get some work done at a low threshold on this and do some aerobic work. Again, you can explore this yourself. We're interested in the game of getting these tissues pumped. And what we found is instead of working at a load of a 1 rep maximum, which is really difficult for us to understand based on the surgery and arousal and time, and et cetera, what instead we have found to be a really excellent protocol is to perform 30 seconds of work and 30 seconds of rest. And so any kind of work that can be done for 30 seconds. So if you were bench pressing and you're working on your arms, you might need to choose a load that you could actually floor press or bench press for the 30 seconds. It doesn't matter so much what exercises you're choosing. Ideally, we're choosing an exercise that is loading the tissues that have been surgically repaired, or I'm going to try to do some tissues that maybe unload that. So you'll see that there's a lot of ways to use this. So here I have got my hip, and I'm going to go ahead and take this up to the maximum 180 for me, because I know that I can easily handle that. My tissues actually will go handle higher loads than 180 here. So I've got 180 on here, and already a couple things that I want to remind you. One, if you think this is not appropriate, don't do it. No numbness and tingling anytime. That's not the game. So if you're getting tingling or you're losing sensation, you've exceeded what we're trying to do here. So now I've got this thing locked off in my hip, and if I was immobilized or I couldn't weight bear, I could do this for 30 seconds. So just performing any kind of work. Here I'm going to do 30 seconds of quad sets, or do 30 seconds of ankle pumps, and then rest 30 seconds. And part of the magic here is not to continue to work, but to let the system sort of accumulate metabolites. The muscles now, the blood flow is sort of being altered, and the muscles aren't pumping the new stuff in. And then after 30 seconds, I just perform 30 seconds of work again. And again, this could be as simple as assisted toe raises. This could be mini squats. This could be a hip hinge. This could be open chain. This could be kettlebell swings. This can be an easy assault bike. The idea here is to do some work, and this allows us to have the same kind of benefits of real heavy loading without any of that heavy loading. And it allows us to feel like we've done work and to get a big pump. One of the nice things about this, as I mentioned earlier, is that it can have some analgesic effects. The research is supporting that regular use of blood flow helps with pain control. So as a personal anecdote, one of the reasons I like to use it is instead of going for the full 5 minutes of 30 seconds on, 30 seconds off, repeated 5 times, I really like to do a 3-minute piece before I exercise. So I would go ahead and put it on both sides, either get on the bike or do some air squats, something in a range that I could control. And then I would get these wicked pump outs where the tissues are really engorged with blood. And then I would be able to handle higher loads. So in short, what we're trying to do is give you this introduction. You'll see that the prices of these things can vary wildly from $100 all the way up to $300 for the automatic app-driven ones. This company that we've ended up liking very much is Occlusion Cuff. I feel like they're reasonably priced and wide and comfortable. This is the Occlusion Cuff Pro. Again, just using this manual, I don't like to use digital devices. I don't like to charge things. It's my own personal sort of game here. But keep in mind, our idea is to try to have an intervention. Do voodoo floss bands work? Yes, they work great. So we could use that wide voodoo floss band and wrap it at just a comfortable 4 to 6 out of discomfort on the hip and a 4 to 6 out of discomfort on the top. Sometimes you'll see higher sort of subjective compression that you can go to 6 to 8 out of the lower limb and 4 to 6 on the upper limb. But I just say, hey, 4 to 6 out of a possible 10 in discomfort. And you'll see that even if you went onto Amazon and you saw just the belts, they recommend the same thing. So there's lots and lots of ways to do this. This is a wonderful adjunct to your rehab training to keep your muscle mass on, to keep those tissues engorged and muscle units recruited. Take a look at it, do some research on your own, talk to your physical therapist, talk to your physician about how to integrate occlusion, more importantly, blood flow restriction training into your rehab process.